Gentlelady from Florida, Ms. Castor.
Thank you, Madam Chair. America's Affordable Health Choices Act will reduce the cost of health care for America's families and improve the health of our great nation. Chairman Waxman, Dingell, and Pallone have been inclusive and open-minded, and on behalf of the hundreds of thousands of folks I represent, I thank them for including many of the reforms I have advocated on behalf of Floridians and all American families. I also thank my colleagues for their broad-based collaboration on this historic legislation. The health of our families and our neighbors is fundamental. But over the past decades, paying for health care has gotten to be too expensive. Insurance premiums have risen 3 times faster than wages. Insurance companies have raked in billions in profits, they've played games with people, and they've left folks with pre-existing conditions out in the cold. Meanwhile, some Americans do not take personal responsibility for their health like they should, and we all end up paying their health care costs when they show up at the ER with complicated and costly conditions. But we're not going to give up, and we're not going to give in to the naysayers and the special interests. And it is clear that President Obama is not going to give up. We're going to build on what works and fix what is broken. Our bill ensures that 97% of Americans will be covered by a health care plan that is both affordable and offers quality standard benefits. This is critical to my home state of Florida. It's a large state that's a microcosm of the nation. We are urban and rural. We are diverse. And we have a serious health care crisis. 2 out of every 5 Floridians do not have health insurance. That's 38% of the population of my state. And the overwhelming majority are working families who are doing everything right, but health care in America is broken for them. But now there is hope. You know, I've spoken with so many who are holding off on necessary medical services that are in their 50s or early 60s. They are just holding on until they turn 65 and they qualify for Medicare, praying that they get there. And for the families who have health insurance, the costs are going up, up, and up, and they simply can't afford it anymore. But this innovative bill provides solutions for those families, a uniquely American solution to control costs and put patients first without burdening future generations with debt. We're going to stop the denials of care based on pre-existing conditions, race, and gender. And I'm convinced that one of the ways we're going to rebuild our economy and put people back to work is through a modern health care workforce in new community health centers and conveniently placed clinics throughout our neighborhoods. This frontline workforce of primary care professionals will do a world of good for these students seeking job opportunities in today's economy. Our community colleges and universities will do very well as well. In closing, I'd like to thank Representative Green and all of the members who work to cut bureaucratic barriers for families who need to take their kids to the pediatrician under S-chip. We're going to stand up for those families all across America and put a stop to these skyrocketing premiums and deductibles and ensure that every American has the same opportunity to lead a healthy and productive life.
Gentlelady's time's expired.